Hello everyone. So today we are going to discuss about one of the main systems of our body called as excretory system. So let me show you this excretory system. Yes, coming to the excretory system. So the parts of the excretory system or renal system it is also called as. Okay. So these are the vital organs which we can identify in our body. One is heart, we can identify the brain, lungs, kidneys, and here you can identify the liver and as well as the stomach. Then coming to the organs of the renal system or excretory system are two kidneys, a pair of kidneys are present, and two ureters, and urinary bladder, urethra. So you can identify the kidneys, a pair of kidneys, right and left kidneys. From the kidneys you can identify right and left ureters. Then after that these ureters they opens into urinary bladder. Then from this urinary bladder, the urine it comes outside through urethra. So these are the main important organs which we can identify in the renal system. So let me explain you the location of the kidneys. So kidneys are a pair of excretory organs situated on the posterior abdominal wall. Means so in the abdomen after opening of the abdominal wall outside part, we can identify entire the system. First we can identify the gastrointestinal system, that is stomach at the left side, then liver at the right side, then other areas are occupied by the coils of the jejunum and the large intestine. So behind this all abdominal organs, these kidneys are present behind the gastrointestinal tract, means stomach, liver, intestines. Behind all these organs, we can identify a pair of excretory organs called as kidneys. So they are present exactly above the waist, then extending from the upper border of T12 to the L3 vertebra. This is the vertebral level, and partially projected into 11 and 12 pairs of the ribs. So here you can identify the location of the kidneys behind all the abdominal organs. On the posterior abdominal wall muscles, we can identify a paired organs, excretory organs called as kidneys. So these are retroperitoneal. Retro means behind. Remember this word. Retro means behind. So peritoneum is a sac. Peritoneum is a sac which covers all the abdominal organs, which covers the gastrointestinal organs. Understood? So behind this peritoneum, we can identify this bean-shaped excretory organs called as kidneys. Okay, and they are encased in the renal pad of fat. So these kidneys, right and left kidneys, they are covered. They are covered by the fat. It is called as renal fat. So right kidney is slightly lower than the left kidney because the liver occupies on the right side and the right kidney is pushing the kidney down. That's why right kidney is lower than the left kidney. Then color and shape. What is the color? It is a red color and bean shape, and these are the coverings of the kidney. So from outside to inside, we can identify. Sorry, first we can identify first outside one is renal fascia, then we can identify perinephric fat, then we can identify renal. Uh, yes, here you can see that. So first, exactly strictly speaking, at the surface of kidney is covered by the capsule. Then outside the capsule we can identify perirenal fat. Then outside the fat we can identify renal fascia. Then outside the fascia we can identify pararenal fat. Okay, so these are the structures, four structures coming from inside to outside. Okay, so height and weight. What about the height and weight is each kidney is 11 centimeters in length, and then 3 centimeters in thickness, then 6 centimeters broad, 11 centimeters length, 6 centimeters broad, and 3 centimeters in thickness. So these are the measurements of the kidney. Then kidney are organs associated with the kidneys. So what are the organs covering the kidney? Superiorly we can identify each kidney, right and left kidney. Superiorly we can identify adrenal glands or suprarenal glands. So the name itself it says that supra means above, renal means suprarenal gland. Supra means above, renal means kidneys. Above the kidneys, the glands which are present called as suprarenal glands. Then anteriorly we can identify right kidney. It is related to the right lobe of the liver. Now you must understand anterior to the right kidney, liver is present. Okay, liver, then duodenum, then hepatic flexure of the colon. That is large intestine, or it's also called as a right flexure of the colon. Okay, then posteriorly, what is present behind the kidneys? 12th rib is present, diaphragm muscle is present, then muscles of the posterior abdominal wall. Means behind the kidneys, these abdominal muscles are present. The muscles names are psoas major, quadratus lumborum, and transversus abdominis. Then coming to the relations of that upper pole, as I told you earlier, upper pole you can identify the suprarenal gland, and lower pole, it is 2.5 centimeters above the iliac crest, above the iliac crest. Then you can identify medial border, which you can identify a hilum, means opening of the kidney called as hilum of the kidney. Below the hilum we can identify the ureter. Below the hilum you can identify the ureter. The next things we are going to see are peritoneal relations. What is this peritoneum? Peritoneum is a sac which covers all the abdominal organs. Okay, so right and left kidney, they are related to which structures? Right kidney, which it related to which structures in the abdomen? Left kidney, it related to which structures in the abdomen? That we are going to see now. So the kidneys are retroperitoneal, means behind the peritoneum, these kidneys are present. Certain areas of each kidney are covered in anterior by the peritoneum, whereas others are bare area, means they are not covered by the peritoneum. So the frontal section of the kidney. So if you take a section of the kidney, what we can identify are, so here you can see outside, that is the capsule is present. Then inside the kidney, it is going to divide into two parts. Outer cortex. You can see the word here, cortex. Just wait for a while. Yes. Coming to this outside structure is like this, and then what about the inside? So inside part, as I told you earlier, so here you can see the outside part is called as the cortex. So we took a section, we cut the kidney and we are seeing inside part. So inside we can identify inside the kidney the part which is near to the surface, that is called as the cortex, and below that we can identify a triangular shaped structures. They are present in the region called as medulla. You can see the word here, medulla. Okay, cortex and medulla, you can see both areas over here. Then internal structure of the kidney. So internal structure of the kidney, these these medulla parts, they are called as renal columns. Renal columns, they opens into, you can see the openings of the renal columns. Okay, so renal columns opens into structures called as major calyces. Major calyces. Okay, so the major calyces and the minor calyces, you remember. So here you can identify first medulla renal columns. They opens into small structures, they are called as minor calyces. Minor calyces, they joins with each other and forms major calyces. So the major calyces opens into the renal pelvis. Understood? First, you remember in the medullary region, we can identify triangular structures called as renal columns. Renal columns opens into minor calyces, small structures called as pipe-like structures called as minor calyces. Minor calyces, they joins with each other and forms major calyces. Major calyces opens into renal pelvis. So that is the structure which we can identify in the interior of the kidney. Then this is the structure is exactly, we took a section of the original kidney. How can we identify these cortex, medulla, renal, calyces? Then we can identify the major calyces, minor calyces and all. Okay, so here you can see the cortex outside part, inside part is medulla. What we have seen in the medulla, renal columns you can identify. Renal columns opens into minor calyces opens into major calyces. So major calyces opens into renal pelvis. Okay, so that is about the structures which you can identify inside of the kidney. Then protection of the kidneys, there are three layers of the connective tissue. Inner layer is called as renal capsule. Okay, then middle layer is adipose tissue, then outer layer is renal fascia. These structures you remember, and you can write down these stuff, these notes and all, and you can write in the examinations also. Then the three layers of the tissues surrounds the each kidney. So the deep layer, what I have seen, the capsule. Deep layer is called as capsule. You no need to write more about the capsule. You just mention the surface of the kidney is covered by the renal capsule. Then you can identify the middle layer. It is adipose tissue called as perirenal fan. Perirenal fan. Then superficial layer it is called as renal fascia. Renal fascia. So outside the renal fascia we can identify pararenal fan. Four layers you remember. Four layers you remember. Deep layer is called as renal capsule. Then middle layer is called as perirenal fan. Then outside the renal fat, we can identify superficial layer. It is also called as renal fascia. Outside the renal fascia, also we can identify the fat called as pararenal fat. You try to listen carefully and you can write down these notes. You don't need to write all these things in the examination. You just mention four layers and the names of the four layers which are covering the kidneys. So coming to the gross structure of the kidney, what is the structures present inside? So as we have discussed earlier, outside part you can identify the kidney, inside part is called as medulla. So renal fibrous capsule which is covering the outer surface of the kidney. Then inside we can identify cortex area, cortex, here you can see the cortex. The cortex is a reddish brown layer of the tissue immediately below the capsule which is present and outside the renal pyramids. Okay, renal pyramids. Outside the renal pyramids, inside the renal capsule, this area is called as capsule. Then medulla. In the medulla, we can identify it is consisting of a conical shape or pyramidal shape striations called as renal pyramids. These are the renal pyramids. Then hilum. So it is having two borders, lateral border and the medial border. The medial border we can identify opening of the kidney called as hilum of the kidney. Through the hilum, we can identify blood vessels are entering inside the kidney, means arteries are going inside and the veins they are coming outside through this opening called as hilum of the kidney, which is present at the medial border of the kidney. Then renal pelvis. Renal pelvis it is a funnel shaped structure which acts as a receptacle receptacle of the urine formed by the kidney. So here you can see the major calyces opens into the structure main pipe. This is called as renal pelvis. Okay. So then it has a number of distal branches called as calyces, each of which surrounds the apex of renal pyramid. So that's what we have discussed earlier. Urine formed in the kidney passes through the papillae at the apex of the renal pyramid into minor calyces. So here you can see the minor calyces. Minor calyces opens into major calyces, opens into renal pelvis. Remember these structures. This is renal pyramid, minor calyces, major calyces, renal pelvis. Then coming to this next structure is this is the intravenous spherogram. You can see the it is also called as KUB X-ray, kidneys, ureter, and bladder. Here you can identify minor calyces, major calyces, and renal pelvis as well. Okay, and urinary bladder also you can identify, and very slightly you can identify the ureter. So coming to this arteries, the glomerular capillary is called as glomerulus. The usual direction of the blood flow first it enters into the blood supply of the kidney is by renal artery. So artery it is going to divide into arterioles they are going to divide into capillaries going it is going to divide into the venules. Okay, then venules they join with each other and form the veins. So here you can see that how the blood supply to the kidney is happening. First from the abdominal aorta renal arteries are arising, then enters into the kidney, they divides into segmental arteries, then interlobar arteries, Then interlobar arteries, they are going to divide into arcuate arteries. Then arcuate arteries, they are going to divide into interlobular. Then after that, it is going to divide into 5 to 8 capillaries. Okay, that is about, yeah, here you can identify the renal artery. Then it is going to divide into segmental arteries. Segmental arteries, they are going to divide into arcuate arteries. Then interlobar arteries. Then here you can see the interlobar arteries. Then after that, interlobular arteries. These interlobular arteries. Then after that, how does it happen? From the kidney, the carbon dioxide blood enters into interlobular veins, then arcuate veins, then interlobar, segmental, then renal, and then they drains into inferior vena cava. So maybe perhaps these arrows are there projecting down, but it is totally opposite. So from this interlobular arteries, then capillaries. From that, the venous blood enters into interlobular veins, then arcuate vein, then interlobar, segmental, renal, and then inferior vena cava. So here you can identify that. Yes, here you can see the interlobular. Then they enters into this arcuate. Arcuate opens into this segmental. Then you can identify into renal vein. Renal vein opens into inferior vena cava. So where does this filtration, where does this reabsorption process takes place is, it takes place in the structural and functional unit of kidney is called as the nephron, that we are going to discuss shortly. Okay. Then the nerve supply of this is renal plexus from celiac plexus, sympathetic and parasympathetic. So sympathetic coming from the T10 to L1, then afferents from the kidney, it enters into the kidney pain and all, how we can feel they enters into the T10 to T12 segments. So it regulates the blood flow to the kidney by causing vasodilation or vasoconstriction of the renal arterioles. These are the lymphatic drainage of the kidneys. Okay, so the lymphatic drainage, it is by the lateral aortic nodes, then the renal group of the lymph nodes, pararenal group of the lymph nodes. Yes, here you can identify the lumbar aortic group of the lymph nodes. Lymph nodes, if any infection is present surrounding the kidney, we can identify the enlargement of these lymph nodes. If they swell, it says that some infection is present in that particular region. Okay. Then muscles attached to the kidney. Behind the kidneys, we can identify the three muscles. One is quadratus lumborum. Here you can identify the quadratus lumborum. Then psoas major. This transverse fibers, they are called as transversus abdominis. Three muscles which are present behind the kidneys. So these are the parts of the kidney once again. So what are the parts? Inside, outside you can identify the capsule. Then inside the kidney you can identify outer cortex, inner medullary region. Inner medullary region, renal. What are these structures? Renal pyramids are present. Renal pyramids, they opens into minor calyces, they opens into major calyces, then they opens into renal pelvis. Okay, the blood vessels which are going inside, the arteries which are going inside, they are renal artery. You can see the number renal artery. Renal artery is going to divide. They are going to divide into the segmental, then arcuate, the interlobar, then interlobular arteries. So this is the microscopic anatomy. This is not necessary for you, but here you can see the how the reabsorption process takes place. So these arteries, they are bringing the blood. They are bringing the blood. Okay, oxygenated blood. Then after that, it enters into the kidney. Then inside the kidney, you can identify the structural and functional unit of kidneys, excretory system called as nephron. It enters into the glomerulus. Then after that, from the glomerulus, it the excretory, sorry, the reabsorbed blood, it enters into a segment called as thick descending segment. You can identify the big pipe over here. So this big pipe, it is called as thick descending segment. Then after that, it opens into thin descending segment. Then we can identify a loop called as Henle's loop or loop of Henle. Then it is extending upwards as thin ascending tube. Then after that, it opens into thick ascending tube. Then after that, it opens into the distal part called as distal convoluted tubule. And here we can identify PCT called as proximal convoluted tubule, and here it is called as distal convoluted tubule. So that is how through these pipes the absorbed material, which again is going to absorb. So why again it is absorbing? So the important electrolytes and water which is necessary for our body, they are going to absorbed by these kidneys. If it is more, they will excrete. Okay, understood? If you take more water, if you drink more water, the excess water will be sent out, excreted out in the form of urine. The water which is required for our body, that will be stored in the body. If you consume more water, the water will go out through in the form of urine. In the same way, if you have more electrolytes, that electrolytes they are going to send out through this process. Okay, that is the main action of the kidneys. So this is the parts, types of the nephrons, two types: cortical nephrons and juxtamedullary nephrons. These are the things you are going to study in the physiology. If you want these types also, you can just go through it: cortical nephrons and the medullary nephrons. So these are the differences of cortical nephrons and the juxtamedullary. Juxta means near, near medulla. Okay, cortical means which are present in the cortex. Juxtamedullary nephrons means the nephrons which are present near to the medullary part of the kidney. So these are the structure and functions. These are all we are going to study in your physiology. If you want, you can just write down the notes, but you don't need to write in the examination point of view. Then coming to this, other structures which are important, I will explain you. Okay. So these are the functions you have to write. So after writing about the kidney, you have to write about the functions: urine formation, excretion, regulation of electrolytes, then regulation of acid-base balance. These are the functions of the kidneys. Okay. So just bear with me. I will show you another presentation. So far we have seen the interior of the kidney, and now we are going to see the outside part of the kidney. So coming to the outside part of the kidney, so what are the structures we can identify are, so it is having superior pole and the inferior pole. So in the previous time we have seen the interior, and now we are seeing the exterior. So it is having two poles, superior pole and the inferior pole. It is having two borders, medial border and the lateral border. And it is having two surfaces, anterior surface and behind that is posterior surface. So here we are seeing the at the superior pole you can identify suprarenal gland, and inferior pole is free. Coming to the medial border, we can identify a opening called as hilum of the kidney, where the renal arteries they are passing inside and the renal veins coming outside of the kidney. And also other structure which is coming outside is the renal pelvis. So the structures which are present at the hilum of the kidney from anterior to posterior, one is vein, renal vein, then renal artery, and most posteriorly we can identify the pelvis, renal pelvis. The surfaces, as I told you earlier, it is having anterior surface and the posterior surface. So you can see that irregular surface is the anterior surface, and the flat surface is the posterior surface. Okay, borders, as I told you earlier, medial border here. This is the medial border, which we can identify the hilum, and this is the lateral border of the kidney. So as I told you earlier, this at the hilum of the kidney, we can identify renal vein. Here you can see the renal artery and renal pelvis. So the relations, once again, the right kidney anteriorly related to the liver, then right flexure of colon, the large intestine, then jejunum, and here you can see the duodenum. So these are the anterior relations of the right kidney. These are the anterior relations of the left kidney. So anteriorly, the left kidney is related to stomach, then spleen, then pancreas, then here you can see the descending colon or left flexure of colon and the jejunum, coils of the jejunum. This is a clear diagram of the anterior relations of the kidney. So you try to copy this diagram, and when you are writing in the examination, You keep heading as relations and draw this diagram. That is more than enough. If you remember, you can elaborate it and write. Otherwise, you just draw this diagram and label it. That is more than enough. Thank you. Then posterior surface relations, already I told you the three muscles you write. So the muscles are, these are the three muscles, psoas major, quadratus lumborum, and we can identify the transversus abdominis muscle. So here, this is how the kidney is present. Here you can see the kidney. So the left kidney, how it is, left kidney is little higher, right kidney it is little lower. So that's why the left kidney posteriorly it is related to the 12th rib. So these are the muscles, and here you can see the psoas major muscle, and then these nerves which are present over here, the subcostal nerve, iliohypogastric, and ilioinguinal. These are the three nerves which are posteriorly related to the kidneys. Then other structures, coming to the ureters. Ureters, these are the two pipes. The ureter is continuous with the funnel shaped part called as renal pelvis. The ureters are the tubes that convey urine from the kidneys to the urinary bladder. Okay, these are the muscular tubes. These two ureters are the muscular tubes that extends from the kidney to the posterior surface of the urinary bladder, where the urine is propelled along the ureter by peristaltic contractions. So these are the measurements and the parts of the ureter. Okay, so measurement it is 25 to 30 centimeters and continues with the renal pelvis. In the abdominal cavity, it lies on the psoas major muscle and enters the pelvic cavity. Then after that, it opens into the posterior part of the urinary bladder. The ureter relations are it lies within the hilum of the kidney. Then it receives the major calyces. Then it enters into the pelvis by crossing the bifurcation of common iliac artery. So the abdominal aorta is going to divide into right and left common iliac arteries. So these are not necessary for you. Blood supply of the ureter, you just write down renal, gonadal, and vesicle. Renal artery, it supplies to the upper part of the ureter. Gonadal artery supplies to the middle part of the ureter, and lower part of the ureter is supplied by the vesicle arteries. Okay, then lymphatics, then the nerve supply sympathetic and parasympathetic. You write for any abdominal organ, the nerve supply is sympathetic and parasympathetic. Okay, the sympathetic it is by renal, testicular, and ovarian hypogastric plexus. Parasympathetic it is by the sacral plexus. Then these are the constrictions. These are not that much required for you guys. Then coming to the suprarenal glands. These suprarenal glands are yellowish retroperitoneal organs. They are present at the upper pole of the kidney. Upper pole of the kidney. So each gland it has a yellow cortex and dark brown medullary part. Okay, so this is about the left suprarenal gland. Here you can see that, and right suprarenal gland. So structurally, what we can identify inside the suprarenal gland are cortex and medulla. Same thing as you have seen in the kidneys. So the cortex of the suprarenal gland, it is consisting of the mineral corticoids, glucocorticoids, and sex hormones. Okay, so the three layers are present: zona glomerulosa, zona fasciculata, and zona reticularis. You remember these names, you have to write in the examination. Zona glomerulosa, zona fasciculata, and zona reticularis. Zona glomerulosa, which is consisting of mineral corticoids, which control the fluid and electrolyte. Zona fasciculata, it is consisting, they secrete the glucocorticoids, which contacts the carbohydrates, which absorbs the carbohydrates and the fats and proteins. The zona reticularis, which is responsible for the releasing of sexual hormones, which probably play a major role in the prepubertal development of the sexual organs. The medullary part consisting of secretes the catecholamines, epinephrine, and the norepinephrine. This is the blood supply of the suprarenal gland. So here you can see the suprarenal arteries and the suprarenal veins. Then coming to the urinary bladder, it is a bag which stores the urine which is present in the pelvis region, which presents in the pelvis region. Collapsible muscular sac. It stores and expels urine. It lies in the pelvic floor, posterior to the pubic symphysis. In the males, anterior to the rectum. In the females, it is lying anterior to the vagina and the uterus. So it's a final common pathway, the urinary bladder, which is it is a hollow muscular organ. It is generally smaller in females due to the presence of the uterus. Retroperitoneal, it is also in the pelvic cavity, posterior to the pelvic symphysis or pubic symphysis, and is freely movable. And bladder muscle is the detrusor muscle. Yes, here you can identify. So in the males, how it is present? In the males, it is present in front of the rectum. In front of the rectum. In the females, it is present in front of the uterus and in front of the vagina. Okay, in front of the vagina. Then coming to this, the parts of the urinary bladder, it is having apex base, then superior surface, and two inferolateral surfaces. Understood? You write down these things. The parts of the urinary bladder are apex, base, superior surface, and two inferolateral surfaces. Okay, two inferolateral surfaces and the neck of the urinary bladder. Okay, so let me show you first apex which is projecting anteriorly. Try to see my arrow. I'm showing you an arrow here. So that arrow which we can identify the apex, it is holding the urinary bladder anteriorly. So here you can identify a fold called as median umbilical fold. Median umbilical fold. And coming to the next part is a base which is present, here. You can see the base part in the males. Posterior part, it is also called as the base of the urinary bladder. In the reproductive system, what we have seen at the base of the urinary bladder, the ductus deferens or vas deferens which is extending and it is running superior to the urinary bladder, then it is running posterior to the urinary bladder. Then the ductus deferens or vas deferens, it is enlarging and forms, what is that name? Ampulla of the ductus deferens. Then we can identify the seminal vesicles. These two, they join with each other and forms what they forms the seminal vesicles, seminiferous tubules, then ejaculatory ducts. This enlargement of the ductus deferens called as ampulla and the seminal vesicles, they joins with each other and forms the ejaculatory ducts. The ducts are pierced. The duct is piercing the prostate gland and opens into prostatic urethra that we have seen. So what I want to say is here we can see the apex and the base is present behind the urinary bladder and in front of the rectum in the case of males. Males in males only it is present like that. Then what happens in the females? So here what happens in the females is posterior surface of the urinary bladder. It is related to anterior wall of the vagina. Anterior wall of the vagina. Okay, so that is the apex and base. Then coming to the superior surface, here you can see entire this is the superior surface, and here you can see inferolateral surfaces. Inferolateral surfaces, and here you can identify the neck of the urinary bladder. Neck of the urinary bladder. And here we can identify, as I told you earlier when I am discussing about the ureters, they are piercing the posterior part of the urinary bladder. So we can identify the openings of the ureters over here, right and left. Then below we can identify the neck of the urinary bladder. We can identify a triangular shape area over here. That triangular shape area is called as trigone of urinary bladder. Trigone of urinary bladder. And here, the neck of the urinary bladder, we can identify a small sphincter called as internal urethral sphincter. Internal urethral sphincter. Below that, we can identify another sphincter called as external urethral sphincter. External urethral sphincter. So these sphincters, they are present in the perineum region. Perineum region. So perineum is a region which is present uh, behind the pubic symphysis and anterior to the coccyx bone, lower end of the vertebral column. So this is a bladder structure. What is present inside? So outer layer, middle layer, and innermost layer. Outer layer you can identify the connective tissue. Middle layer you can identify the smooth muscles, and innermost layer you can identify the transitional epithelium. Transitional epithelium. So this is about the urinary bladder. So what happens to the urethra? Coming to this urethra, urinary bladder, it opens into urethra, extending outside as the urethra. A small tube from the floor of the bladder to the exterior of the body. In the females, it is fairly straight path, exits anterior to the vagina. Okay, it is very small in the case of females. In the case of males, it is passing through the prostate gland, then it passing through the perineum region, then it is passing through which part of the penis? Bulbospongiosus of the penis. Okay, so once again, we just remind the genital organs, the penis part, root of the penis. We can identify bulbospongiosus. Through that bulbospongiosus, it is passing. So here you can see the female urethra, and here is a male urethra. So because the of the presence of the urethra, yes, here you can see that. So because of the presence of the urethra is near to the genital organ, the vagina, and near to the anal orifice, the urinary tract infections are most common in the case of females than the males. Okay, so that is about urethra. So, in the parts of the urethra in the case of males, as I told you earlier, so this is the neck of the urinary bladder, and as it is passing through the prostate gland, that part is called as prostatic urethra. Then it is passing through the perineum part, perineal membrane, called as membranous urethra, and it is enters into the bulbous spongious of the penis, called as bulbar urethra. Rest of the part is passing through the body of the penis, called as penile urethra. Okay. So this is the urethral sphincters in the both sexes, means in the males and the females, how it is present. Internal urethral sphincter and external urethral sphincter. So anomalies. So this is about the abnormalities of the kidneys. Agenesis means one or both fetal kidneys are absent. Hypoplasia means small kidney. Ectopic kidneys means they are present in the abnormal position. Horseshoe kidneys, pancake kidneys, polycystic kidneys. So these are all the abnormalities of the kidneys. Yes, here you can see the hypoplasia, small kidney, and here you can see the ectopic kidney, means outside of the position, outside of the location you can identify. And lobulated kidney, okay, lobulated kidney, polycystic kidney, horseshoe shaped kidney, and here you can identify the pancake kidney. Epispadiasis or hypospadiasis. So opening of the urethra, external urethral orifice, sometimes it opens into the perineum region, and sometimes opens into the scrotal sac, and sometimes opens into the penis and between the scrotum, and sometimes it opens into the middle part of the penile urethra. Okay, so actually it has to open in the glans penis, but in sometimes in the abnormal genetical abnormalities, it may opens into any other part. Okay, so it's a normal, and this is a hypospadiac, and this is the epispadias. Renal trauma. Renal trauma means stones, renal calculus, which are present. This is also one clinical aspect of the kidneys. There's a Cushing syndrome. So these are the clinical aspects of the kidneys or excretory system. Thank you guys. If you have any doubts, please once again you study and you can contact me. But please subscribe to my channel so that you will get new updated videos. Thank you guys.